Could the common pain relief medications we turn to during illness actually be paving the way for antibiotic resistance? Recent research from the University of South Australia is shedding light on this concerning notion. In a groundbreaking investigation, scientists revealed that the popular over-the-counter drugs, ibuprofen and paracetamol, also known as the acetaminophen, not only contribute to antibiotic resistance when taken separately, but when combined, they significantly worsen this effect. This study delves into the interactions between these medications and a widely used antibiotic, ciprofloxacin, along with Escherichia coli, E. coli, a common bacterium that often leads to infections in the digestive and urinary systems. Alarmingly, the findings indicated that the presence of both ibuprofen and paracetamol dramatically heightened the rate of bacterial mutations, resulting in E. coli becoming much more resistant to ciprofloxacin. While many are aware that excessive use of antibiotics can lead to resistance, few realize that seemingly harmless medications like ibuprofen and paracetamol may be quietly exacerbating the issue. Understanding antibiotic resistance. Antibiotic resistance is a growing concern that poses one of the greatest threats to global health today. This phenomenon occurs when bacteria evolve and adapt in ways that invalidate the effectiveness of antibiotics, medications we rely on to eradicate infections. Dr. Saranjit Chatterjee, a senior consultant in internal medicine at Indraprastha Apollo Hospital in Delhi, notes that such resistance can lead to common conditions such as urinary tract infections, pneumonia, or even minor wounds becoming significantly harder to treat and, in some instances, utterly unmanageable. Study insights from the study. The study's lead researcher, Associate Professor Riti Venter from UniSA, explained that when bacteria were subjected to exposure from ciprofloxacin alongside ibuprofen and paracetamol, they exhibited a marked increase in genetic mutations compared to exposure to the antibiotic alone. This accelerated mutation allowed the bacteria to proliferate more rapidly and develop notable resistance not only to ciprofloxacin but also to various other antibiotics from diverse classes. The hidden risks of OTC medications. Ibuprofen and paracetamol are two of the most commonly used medications across the globe, favored for alleviating pain, managing fever, reducing inflammation, and providing relief from headaches. Regarded as safe, these drugs are staples in many households. However, it is now becoming increasingly clear that they might have unforeseen consequences on the bacterial organisms residing in our bodies. Dr. Chatterjee elaborates on this concept, noting that our bodies host trillions of bacteria, both beneficial and harmful, that constantly engage with every substance we consume, including our medications. Interestingly, while these medications can induce stress on bacteria, an outcome often viewed as beneficial since stress can lead to bacterial death, this is not always the case. In some instances, bacteria can activate survival strategies in response to stress, which may involve mutating or altering their structures to evade the effects of antibiotics in the future. Even more alarming is the enhanced impact observed when ibuprofen and paracetamol are used in conjunction, which may hasten the process of bacterial resistance. This research serves as an urgent reminder for all of us to carefully consider the implications of routinely mixing medications, especially in elderly care, where many patients are often prescribed a combination of long-term treatments. The World Health Organization, WHO, has already declared antimicrobial resistance as a critical public health threat, attributing it to approximately 1.27 million deaths worldwide in 2019 alone. As we reflect on these findings, one must ponder: do we truly understand the full impact of the medications we take so casually? How do we weigh the convenience of over-the-counter drugs against their potential long-term risks? We'd love to hear your views. What do you think about the relationship between common painkillers and antibiotic resistance?